Our bones are the silent, steadfast architecture of our bodies, you know. They are the framework that allows us to stand tall, the shield that protects our vital organs, and the anchor for the muscles that enable every movement we make, from a powerful stride to the gentle lift of a hand. We often take this internal scaffolding for granted, assuming its strength and permanence. However, like any complex structure, our bones are in a constant state of change throughout our lives. They are living tissues, continuously breaking down old cells and rebuilding with new ones. This dynamic process is what keeps them strong and resilient, able to withstand the daily pressures of life. As we journey through the years, this delicate balance of bone renewal can shift. The process of building new bone can slow down, while the breakdown of old bone continues at its usual pace, or even accelerates. Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. Think of a healthy bone like a dense, tightly woven honeycomb. It is strong, resilient, and can handle a great deal of stress. Now, imagine that same honeycomb with larger and larger holes appearing within its structure. It becomes more porous, less dense, and significantly more fragile. This is essentially what happens inside the bones of someone with osteoporosis. The internal support network thins out, leaving the bone vulnerable to fractures even from minor stresses like bending over, coughing, bumping into furniture. The loss of bone density happens quietly, deep within your skeletal system. For many, the first indication is a sudden, painful fracture, often hip, spine, or wrist. It becomes more common with age, but it is not inevitable. Genetics, hormones, and lifestyle play a role. That is why noticing subtle signs matters. Your body offers clues long before a crisis. Back pain is incredibly common, affecting millions for many reasons. We strain muscles, sleep awkwardly, or sit too long. Because it is so prevalent, a nagging ache is easy to dismiss. If it lingers without a clear cause, it could be a quiet signal from your bones. Tiny compression fractures in the vertebrae can produce a dull, persistent ache, or a sudden sharp pain. It may worsen when standing or walking and feel better when you lie down. Pain relievers may help briefly, but they do not fix weakened bone. Is it new for you? Has it lasted weeks? Did it appear out of nowhere? Be specific about where it hurts and what changes it. A conversation with your doctor can identify weakened spinal bones early. Ignoring persistent back pain can allow more compression to occur over time. Early clarity leads to better outcomes. Have you ever stood back to back and found you are not as tall as you used to be? Maybe trousers seem longer, or you sit closer to the pedals. A small change over decades is common, but losing an inch or more can signal osteoporosis in the spine. Vertebrae can weaken and slightly collapse, shortening the spinal column. It is often shrugged off, yet it reflects structural change, not just cosmetics. Measure your height at annual checkups. Mark it at home yearly to track change. If you notice a definite decrease, tell your doctor. Objective data supports a deeper look at bone health. Section 5. A change in your posture. A visible stoop or forward hunch, kyphosis, often reflects compression fractures. Vertebrae weaken and collapse in front, forming wedges, curving the spine forward. It happens gradually. You might notice it in a profile picture or a shop window. Clothes may fit differently, necklaces may not lie flat. This is not just slouching, it is a skeletal change. Beyond appearance, it can cause chronic back and neck pain, and in severe cases, reduce lung space. It may affect digestion, a domino effect on health. Strengthen the muscles supporting your spine, upper back and core. Try gentle band rows and the Superman exercise. Consult a physical therapist for a plan. It may seem surprising, the health of your fingernails and your teeth and your gums. Bones and teeth are mineralized tissues that rely on steady nutrients, especially calcium. If calcium is low, the body may pull it from stores like the jawbone. Weak, brittle fingernails that split, crack, and break easily can point to systemic issues. Water and chemicals affect nails, but persistent decline with other signs warrants a bone health look. In the mouth, receding gums and tooth loss can reflect jawbone thinning. As the jaw weakens, gums pull away and pockets foster periodontal disease. Dentists may spot osteoporosis on routine X-rays. Tell them your concerns and medications. Maintain diligent oral care, regular checkups, and ensure calcium and vitamin D to support bones, teeth, and nails. This is perhaps the most definitive and alarming sign of underlying osteoporosis. We associate broken bones with major accidents or high-impact sports, but weakened bones can fracture from surprisingly minor incidents, a fragility fracture. It is force that would not usually break a healthy bone. Examples: a fall from standing height or less, tripping on a rug or slipping on a wet floor. Even a forceful cough or a strong hug can fracture a rib in severe osteoporosis. Common sites: wrist, hip, and spine. Too often the break is treated but the cause is missed. If a minor fall breaks a bone, advocate for a bone health assessment. Ask, could this be osteoporosis? Should I have a bone density scan? A fragility fracture should trigger evaluation. Diagnosis leads to treatment that reduces future fracture risk. You might not connect grip strength with bone strength, but research links them. Grip reflects overall muscle strength, which often tracks with bone density. With age, we lose muscle, sarcopenia, and bones can thin, raising fall risk. A weaker handshake, struggling with jars or groceries, signs of declining strength. Low hand grip strength correlates with lower hip and spine density. Weak legs and core show up in daily moves. Practice sit-to-stands and supported single-leg balance. For grip, squeeze a tennis ball. Aim for 8-10 controlled repetitions. You do not need a gym. Regular, gentle strength work supports bones and stability. Improving strength and balance helps prevent falls, the leading cause of fractures. Your bones are the foundation of your active life. Recognizing quiet signals preserves their strength. We have walked through 7 silent signs: persistent backache, loss of height, stooped posture, brittle nails, dental issues, fractures from minor incidents, and a decline in muscle strength. One or more signs does not mean osteoporosis, but it is time to talk. A DEXA scan is simple, painless, and non-invasive. Early detection empowers better choices in diet, exercise, and treatment. Your future self will thank you for it.